Hey y'all, sorry in advance, I have 7 kids here, so hopefully they don't interrupt. Okay, so description of an NG tube. The NG tube is a tube that is going to go through the nasal cavity into the GI tract, and for this to work, the GI tract has to be functioning. So people who are critically ill on mechanical ventilation, receiving chemo and radiation, have extensive burns, have neurological or psychological disorders that cause them not to be able to intake food orally. Patients with anorexia, these patients are usually who have the NG tubes. So when we decide to put an NG tube in, we're going to check the HCP's orders, and then we're going to use 2 patient identifiers for identifying the patient. And that's going to be name, date of birth, and then of course we're going to check their bracelet. We're going to look at the reason for the need of the NG tube. We're going to have to explain this procedure to the patient, so we do need to know the reason why we're doing an NG tube. So we're going to come in, we're going to introduce ourselves, we're going to check the order, we're going to check the patient's identity, we're going to provide privacy, we're going to wash our hands, we're going to have all of our equipment ready at the bedside table. We're going to measure the tube from the nose down, or to the earlobe, down to the xiphoid process, and we're going to use a permanent marker to mark that area. So when we do this, when we mark that tube, we're able to check tube placement for later on. We'll know if that marker or that mark has disappeared. It may have went down further. If it's the mark's down to the chest, the thing may be coming out. So another thing we want to do before we ever insert the tube is we're going to check bowel sounds. Like I said, has to be functional. We're going to check that gag reflex, and we're going to check the nasal cavity for polyps, deviated septum. We want to make sure there's not going to be anything to keep us from inserting that tube. Also, during insertion, if the patient starts coughing or turning blue or vital signs start changing, we're going to pull back on that tube as we're inserting it. And then, of course, afterwards, we're going to look in the patient's throat. We're going to make sure that tube is not coiled. We're going to auscultate lung sounds, make sure it's not in the lungs, and we're going to check the gastric secretions, and the pH should be between 1 and 5. So when we do nursing management of a patient with an NG tube, we're going to always check that placement. Although we can look at the marking on the tube, we can auscultate lung sounds, we can auscultate bowel sounds, but the most accurate is always going to be a chest x-ray. And we will do that before we do feedings and before we do medication administration. We're going to be checking their vitals, we're going to be monitoring eyes and O's, we're going to be monitoring for complications. Those include aspiration is a big one, diarrhea, constipation, hyperglycemia in patients who are elderly. They have a glucose intolerance. So constipation, anything to do with the GI tract, it seems, abdominal distension, and things like that. So, to educate the patient, we're going to explain the procedure. We're going to explain why they need it, how it's going to help them. Of course, anyone who is having a procedure done wants to know why. Honestly, myself, I would probably tell them about how long it's going to take. It'll take between 3 and 5 minutes or so, just to help ease the anxiety. We're going to help them cope. If they're going home with this NG tube, we're going to have to tell them how to care for it, try to explain to them how important it is for them to stay elevated, We don't want them aspirating. There's no laying supine. For the goal, we want the outcome to be our patient receiving nutrients if they're not able to provide it for themselves. We want to be able to decompress, lavage. We need to get anything out of that stomach that should not be in there. Now for prevention of aspiration, we're going to keep that bed at a 30 to 45 degree angle. Always ensure correct placement. Again, you can use the mark on the tube. You can auscultate sounds. You can check the GVR and always get that x-ray. If the patient cannot stand or tolerate being 30 to 45 degrees, we can also put them in Trendelenburg, and that'll help for aspiration. To prevent diarrhea, we need to know what medications they're on. If they're on a medication that's causing diarrhea, we need to know if we need to be testing them for an infection, C. diff. If they do, then we need to be able to treat this. We don't want them getting dehydrated. Also, misplacement of the tube can cause diarrhea, so we always want to check that placement. The formula that's going to be given always needs to be refrigerated at least up to 30 minutes before giving it to the patient. If not, it's like leaving milk out overnight and trying to use it the next morning. It's disgusting. Don't do it. Sorry. Maintenance of tube patency. We're always going to flush it with 30 milliliters of warm tap water every 4 hours, before and after each bolus feeding, and every 4 hours for continuous feeding. During continuous feeding, sterile water is what's used for immunocompromised and patients who are critically ill. If the tube is clogged, we're going to use warm water, and we're going to move back and forth with the syringe to flush it. Maintaining tube placement, obtain a chest x-ray. You can check the GVR, you can check the mark on the tube, make sure it hasn't moved. Administration of medication. When giving meds, we're going to flush before, during, and after we're done. If the liquid medications are too thick, we're going to dilute them before we administer them. And if we have tablets, they are going to be immediate release. We're going to crush them and dissolve them in 30 to 60 milliliters of purified water. We are not going to crush enteric or extended release. Now for parenteral nutrition infection. You can get a local infection or you can get a systemic infection. For local, we're going to look for that warmth and redness, purulent drainage. If they have that, we're going to get a culture and we're going to send it and see what we can use to treat that. For systemic, we can draw some blood and send that off to the lab. That way we can get medications. Also, with parenteral nutritional feedings, we can cause fluid in the lungs. So we're going to obtain a chest x-ray and make sure we don't have pneumonia. Patients who are also getting these types of feedings can get hyperglycemic. So we're going to check the blood glucose every 4 to 6 hours, try to maintain a level between 140 and 180. If that's not working, we are going to put that patient on a sliding scale for insulin. Patients who become hypoglycemic, we're going to replace the bag even if it's not empty after 24 hours. For patients who are getting the peripheral line, or they can receive 5% dextrose, and patients with the central line can receive 10 to 20% dextrose to help the patient get out of that hypoglycemic stage. For patient safety, we're always going to make sure our medication matches our HCP's order. So that is very important. We don't want to give anybody the wrong order. We're going to have another RN other than yourself. Another RN is going to check the infusion pump, what information you have on there, make sure it's correct. When you're looking at your solution, you need to check for leaks, color changes, clarity, fat emulsions. If the bag isn't empty, we're going to stop it. Within the 24 hours, we're going to stop it and replace it with the new bag, of course, which needs to be at room temperature. For maintaining solutions, they're all prepared by the pharmacy. So the pharmacy will get the order, they will prepare it, they will put the information on the label, what is all in the solution, the additives, the vitamins, the nutrient content. Then they'll add the time it was mixed, the expiration date and time. It is important to keep the number low for people who are handling this solution. We don't want the patient to get an infection. Also, the solutions are good up to 24 hours and also must be refrigerated for 30 minutes before, or up until 30 minutes before use. So instead of so we're going to keep that medication in a refrigerator until 30 minutes before we use it. That way we're able to get that bag into room temperature and it won't bother the patient as we're feeding them. So that is NG tube and PN, and if I missed anything, please let me know. Y'all can comment, you can text me, we can group chat, whatever y'all want to do. I tried to get it done quick. Like I said, I have so many kids here and I kind of kicked them outside, so I'm about to let them all back in and I gotta get dinner started. But I hope you guys are all staying safe and all your kids are doing okay. I know it's hard staying cooped up in a house. I'm definitely having a hard time, so I'm very excited about going and taking a test Monday and seeing everybody. So if anybody needs anything, just holler at me or whatever we can do to get through this, you guys. See y'all later.